and welcome to my channel. My name is Jazzy RN. If you are a nurse who works at the bedside and you're looking to get away from the bedside and pivot away, this is the channel for you. I've been a remote utilization review nurse for over 9 years, and the goal of my channel is to help nurses pivot from the bedside to remote work. This first company is with Enterprise Engineering Incorporated. They are looking for a concurrent utilization review nurse, and I always go straight to the qualifications first. This job is for nurses who are licensed in California. It is a contract to hire position and it is remote. The qualifications for this job is an RN with an active, unrestricted California nurse license required. A BSN is preferred. A minimum of 2 to 3 years of clinical nursing experience with at least 1 year in utilization review, case management, or a related field. Experience in a managed care setting with medical necessity reviews is strongly preferred. They also prefer the certifications of a certified professional in utilization review, certified case manager, or accredited case manager. Additional clinical nursing or case management certifications are a plus. Strong knowledge of clinical guidelines that includes interqual and MCG and medical necessity criteria. Excellent communication and interpersonal skills to collaborate with healthcare providers, payers, and members. Strong analytical skills and attention to detail in reviewing clinical documentation. Proficiency in electronic health records, utilization management software, and Microsoft Office Suite. Just make sure on your resume you do enter the platforms that you've worked on. So let's say your current job has Cerner or Epic. Make sure your resume has Cerner or Epic on your resume, as well as Microsoft Office or Microsoft 365. I like to use the exact same wording the job description uses. Also, if you go to the description box below, you will see resume tips here about adding the platforms to your resume, how to write your resume, and I always suggest to write this in mind, what you did, why it's important, and how it relates to the job you want. Here's an example here: proficient in electronic health record documentation to ensure continuity of care to provide insurance payer data to determine medical necessity. On the right side, that's basically a template of how my resume is set up. Just make sure that whenever you have your resume set up, the current job is in present tense. The previous jobs are in past tense. If you scroll down more, you will see a bedside nurse versus insurance nurse and how they relate. So a bedside nurse has a patient. Now, a bedside nurse is not only a nurse in a hospital. This will be a nurse in a skilled nursing facility, long-term acute care, inpatient rehabilitation, hospice, etc. That's when you are hands-on with the patient. And if you just scroll down a little bit more, you'll see what you do as a bedside nurse directly relates to what is reviewed by an insurance nurse. And where does the insurance nurse obtain clinical? From the hospital or the skilled nursing facility, etc. Whatever is documented and charted in that patient's medical records on Cerner or Epic is directly related to how the nurses on the insurance side review the authorizations for this patient. So this determines if we actually can approve the authorization. And if the nurse cannot approve it, then it's sent to the doctor, and doctor makes a decision from there. And if you scroll down a little bit more, you'll see interqual and MCG certification. It is kind of fuzzy, but if you were to do a Google search for interqual or MCG certification, you'll come to yourcommission.org for interqual or mcg.com courses for MCG certification. They're both live webinars or workshops, and with the same exact pricing. And this is an option you can take whenever you are applying for these jobs. That way you can make your resume look more marketable because you'll have experience or certification in either MCG or interqual. I have noticed that interqual is more commonly used, but it depends on what your choices are. The jobs I've worked for have all three have trained us using interqual. Only one company started us with interqual, changed to MCG, and then back to interqual again. But the company you work for will train you. The next company is UF Health. They are looking for a clinical documentation integrity specialist RN. This is a flexible remote job. It says Gainesville, Florida, and it is category as office and clerical. This is a work location remote, and you must reside in an authorized state. That includes Florida, Georgia, Missouri, Pennsylvania. North Carolina, South Carolina, Tennessee, and Texas. We'll go straight to the qualifications. You must have an associate's degree in a healthcare related field, which is required. A graduate of an accredited school of nursing preferred. 3+ years experience in clinical documentation improvement. This one actually requires you to have experience. Strong knowledge of healthcare regulations and clinical documentation standards. Experience conducting audits and quality assurance activities. Proven ability to collaborate effectively with clinical providers and coding teams. Ability to develop and deliver staff education and training programs. And the licensure requirements are RN or LPN. They do mention that you have to have a vehicle. So the frequent driver is defined as an individual who drives at least once daily. So employees in this position are designated as frequent drivers and will operate a personal or University of Florida vehicle for assigned business purposes. Now, if they're hiring nurses who don't live in the state of Florida, then I don't think this would apply. But I would, if you end up getting a interview for this job, I would ask about the vehicle requirements and the licensing for your vehicle. The next company is Humana, and they are hiring. This is for a manager. Utilization management, behavioral health nursing. Now, just a FYI, for utilization management, there is medical. So whenever a member is medically unstable, and then there's behavioral health. So the member is medically stable, but not psychologically stable. So this is for a manager, behavioral health nursing. It is remote. It does say Oklahoma here. We're going to go straight to the qualifications. So you must reside in the state of Oklahoma, an RN, RLPC, or LMFT, or LMSW is required. So they do offer this job to persons besides nurses. A minimum of 2 years of utilization management or case management experience. Previous leadership or management experience to include leading people or teams in practices. Preferred qualifications include an advanced degree in nursing, healthcare, or business, and CMS criteria. Now, they do require your internet to be at least 25 megabits per second download speeds and 10 megabits per second upload speeds. And they don't, actually the satellite, cellular, and microwave connection can only be used if approved by leadership. And let's see, employees who live and work from home in the state of California, Illinois, Montana, South Dakota will be provided a bi-weekly payment for their internet expense. Because this job, you must live in the state of Oklahoma. This does not apply. And Humana will provide home or hybrid home office employees with telephone equipment appropriate to meet the business requirements for their position or job. Now, just an FYI, the telephone won't be, I know for the jobs I've worked with, the telephone is embedded into your laptop. So a separate telephone, maybe this is an old statement, but newer companies now, they don't have a separate telephone for your work. It's already embedded into your computer. And work from a dedicated space lacking ongoing interruptions to protect member PHI HIPAA information. That just means they want you to make sure your work office space is a room with a door that locks. And the next position with Humana is a compliance registered nurse. This is remote Virginia. And the requirements for this job is active RN license in the state of Virginia, are able to obtain a multi-state license, a bordering contiguous state that participates in the enhanced licensure without disciplinary action, a minimum of 2 years of auditing experience, preferably in a clinical or MCO setting, that's managed care organization, intermediate to advanced knowledge using Microsoft Office Word, Excel, PowerPoint, navigating multiple systems and platforms, an ability to troubleshoot and resolve basic technical difficulties in a remote environment. Now, the companies I've worked for, we've never had to use PowerPoint, mostly Word and Excel. And Excel, you don't need to have an advanced knowledge of Excel. It just needs to be basic. Navigating multiple systems, this is very necessary because you'll be using different platforms or software while you're working, and you'll most likely have 3 monitors, including your laptop. And the ability to troubleshoot and resolve basic technical difficulties. That's because whenever you're working remotely, you don't have anyone behind you over your shoulder are going to come and help you fix something on your computer. Sometimes you just got to learn how to do it yourself, and if your computer's giving you problems, you can just do a restart. Let people know that, hey, you're starting your computer over because you're getting an error. It does happen, and it happens to everyone. Previous experience with managed care organization, ability to work independently under general instructions and with a team, exceptional oral and written communication and interpersonal skills, and the preferred qualifications are bachelor's degree in nursing, Medicare or Medicaid, DMAS, CMS, and NCQA experience.